If everyone could take their seats, we're going to get started in just a minute. The House Health Policy Committee will come to order. Would the clerk please take the roll?
Chair Rogers.
Here.
Representatives Whitsett. Oh, here. Carter.
Yes, I'm here.
She's on Zoom.
Here.
Carter is on Zoom. She said here. Hadsma.
Here.
Neely.
She's here.
Glanville.
Here.
Kafia.
Here.
Conlon.
Here.
Farhat.
Here.
Fitzgerald.
Here.
Miller.
Here.
Reingans.
Here.
Vanderwall.
Present.
Filler.
Yes.
Mueller.
Here.
Van Workum.
Here.
Roth.
Here.
Schmaltz.
Here.
Thompson. Madam Chair, you have 18 members present. You do have a quorum.
Thank you. Representative Neely moves to approve the minutes from our meeting on October 19. Seeing no objection, minutes are approved. Today we will vote on House Bills 4728 and 5166, which we heard testimony on last week. We will then take up House Bills 4579, 4131, 4213, and 4580, which pertain to continuing telemedicine coverage. We have substitutes on House Bills 4131 and 4213 to consider before voting out to report out. I will then refer House Bill 5144 to the Behavioral Health Subcommittee. With a bill amending the regulations on use of seclusion and restraint in children's therapeutic group homes, we will take up Senator Lauer's legislation, which is Senate Bill 227. And finally, we will continue testimony on the maternal and infant health package and take up House Bills 5169, 5170, 5171, and 5173. First up, we have House Bill 4728. We have cards. Michigan Nurses Association supports the bill. Representative Reingans moves to report House Bill 4728 with recommendation. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett.
Yes.
Carter. Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kafia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller.
Yes.
Reingans.
Yes.
Vanderwall.
Yes.
Filler.
Yes.
Mueller.
Yes.
Van Workum.
Yes.
Roth.
Yes.
Schmaltz.
Yes.
Thompson. Madam Chair, you have 17 yeas, 0 nays, and 0 pass. House Bill 4728 is reported with recommendation.
Moving on, we will take up House Bill 5166. Do we have cards to read in on that one? Michigan Nurses Association supports the bill, and Michigan League for Public Policy supports the bill. Representative Glanville moves to report out House Bill 5166 with recommendation. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett.
Yes.
Carter. Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kafia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller.
Yes.
Reingans.
Yes.
Vanderwall.
Pass.
Filler.
Pass.
Mueller.
Pass.
Van Workum.
Pass.
Roth.
Pass.
Schmaltz.
Pass.
Thompson. Madam Chair, you have 11 yeas, 0 nays, and 6 pass. House Bill 5166 is reported with recommendation.
Returning to a topic we heard testimony on a few weeks ago, we will take up House Bills 4213, 4580, 4579, and 4131. Do we have cards? Thank you. Supporting all 4 bills, Michigan Hospital Association. Supporting all of the 4 bills, Michigan League for Public Policy. And opposing all 4 bills, Blue Cross Blue Shield of Michigan. On House Bill 4213, we have an H1 substitute, which makes minor technical changes at the request of MDHHS. Representative Conlon moves to adopt the H1 substitute for House Bill 4213. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett.
Yeah.
Carter. Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kafia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller.
Yes.
Reingens.
Yes.
Vanderwall.
Pass.
Filler.
Pass.
Mueller.
Pass.
Van Workum.
Pass.
Roth.
Pass.
Schmaltz.
Pass.
Thompson. Madam Chair, you have 11 yeas, 0 nays, 6 pass. The substitute is adopted.
Representative Glanville moves to report HB 4213 with recommendation as substitute H1. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witsett.
Yes.
Carter. Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kafia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller.
Yes.
Reingens.
Yes.
Vanderwall.
Pass.
Filler.
Pass.
Mueller.
Pass.
Van Workum.
Pass.
Roth.
Pass.
Schmaltz.
Pass.
Thompson. Madam Chair, you have 11 yeas, 0 nays, 6 pass. The motion prevails.
Moving on to House Bill 4580, we previously adopted an H1 substitute on this bill on October 5th. Representative Reingens moves to report HB 4580 with recommendation as substitute H1. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witsett.
Yes.
Carter. Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kafia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller.
Yes.
Reingens.
Yes.
Vanderwall.
Pass.
Filler.
Pass.
Mueller.
Pass.
Van Workum.
Pass.
Roth.
Pass.
Schmaltz.
Pass.
Thompson. Madam Chair, you have 11 yeas, 0 nays, 6 pass. House Bill 4580 is reported with recommendation as substitute H1.
Representative Farhat moves to report HB 4579 with recommendation. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witsett.
Yes.
Carter. Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kafia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller.
Yes.
Reingens.
Yes.
Vanderwall.
Pass.
Filler.
Pass.
Mueller.
Pass.
Van Workum.
Pass.
Roth.
Pass.
Schmaltz.
Pass.
Thompson. Madam Chair, you have 11 yeas, 0 nays, 6 pass. House Bill 4579 is reported with recommendation.
On House Bill 4131, we have an H2 substitute, which incorporates language as requested by the Michigan State Medical Society and agreed to upon by Michigan Association of Health Plans. It amends page 1, line 7, after telemedicine by striking the period and inserting the words, unless such services are contractually required per the terms of an affiliated provider contract for telemedicine first or telemedicine only products and clinically appropriate as determined by the healthcare professional. Representative Fitzgerald moves to adopt the H2 substitute to HB 4131. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witsett.
Yes.
Carter. Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kafia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller.
Yes.
Reingens.
Yes.
Vanderwall.
Pass.
Filler.
Pass.
Mueller.
Pass.
Van Workum.
Pass.
Roth.
Pass.
Schmaltz.
Pass.
Thompson. Madam Chair, you have 11 yeas, 0 nays, 6 pass. The substitute is adopted.
Representative Neely moves to report HB 4131 with recommendation as substitute H2. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witsett.
Yes.
Carter. Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kafia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller.
Yes.
Reingens.
Yes.
Vanderwall.
Pass.
Filler.
Pass.
Mueller.
Pass.
Van Workum.
Pass.
Roth.
Pass.
Schmaltz.
Pass.
Thompson. Madam Chair, you have 11 yeas, 0 nays, 6 pass. House Bill 4131 is reported with recommendation as substitute H2.
House Bill 5114 was recently introduced and referred to the Committee on Health Policy. It is my intention to have Chair Braybuck and the Behavioral Health Subcommittee work on this bill. Madam Clerk, please read in the provided letter.
The letter is dated October 26, 2023. Dear Madam Clerk, on October 10th, 2023, House Bill 5114 was referred to the House Committee on Health Policy. This bill amends the Mental Health Code to include individuals licensed as a physician assistant, certified nurse practitioner, and clinical nurse specialists certified in the definition of mental health professionals. I am asking the Subcommittee on Behavioral Health to review and make recommendations to this bill. The shortage of mental health care providers capable of directing individuals in a mental health crisis to the appropriate setting is a serious concern. I am confident that the subcommittee will be successful and productive. Sincerely, Julie M. Rogers, Chair, House Committee on Health Policy.
Thank you, Madam Clerk. Next, we will hear testimony on Senate Bill 227. Joining us, we have, I think Senator Lowers is in committee. So Josh, a legislative director. We will hear from Deborah Johnson, Executive Director of St. Clair Community Mental Health, who is with us virtually. And then we will also hear testimony from Director Elizabeth Hertel. Begin whenever you're ready, and welcome to Health Policy.
Thank you, Chair Rogers, committee members, for your consideration of Senate Bill 227. This was an issue brought to our attention by St. Clair County Community Mental Health, who identified children's therapeutic group homes as one area that could help address the lack of children's psychiatric inpatient beds and would allow these children to also receive care within their own community. Because these homes are prohibited from using restraint in emergency situations, they're incredibly challenging and dangerous to operate. The bill would allow them to utilize emergency safety intervention so long as they comply with Michigan's mental health code and the associated administrative rules. St. Clair and the State Health Department worked on the original language, and the S2 contains a few changes made at the recommendation of DHHS. Representatives of both are here today and can speak more about the S2. Again, thank you for your consideration. Happy to answer any questions or defer them to St. Clair or the DHHS.
Thank you so much. Do members have any questions? All right. You do? No? Okay. We will move along. And so next up, I believe, Goatees, call the chair. House Health Policy will resume. Joining us virtually, we will hear from Deborah Johnson, Executive Director of St. Clair Community Mental Health. Welcome to Health Policy, and begin whenever you're ready. Can you hear us? We can't hear you.
Technology.
We'll give her just a minute. Director Hertel, do you want to join us, and then we'll come back to our Zoom? Thank you.
Good morning, Madam Chair, members of the committee. Thank you for hearing our testimony this morning on Senate Bill 227, and thank you to Senator Lowers and his staff for working with us so closely on some of these changes to 227. So
Can you
as
hear me?
Josh
I can't
mentioned,
hear anyone. Oh, geez.
Yeah, I think this is the chair. We're going to wait because we had technology issues. We're in the middle of testimony, and we'll come back to you if you can pause just for a second.
Thanks. So we wanted to make sure that we were clarifying instances where physical restraint were allowable when it came to child caring institutions, and organizations that are licensed under that child caring institution license. We also expanded that the definitions to include a psychiatric residential treatment facility. The state of Michigan recently submitted a policy to CMS to allow for a benefit for a psychiatric residential treatment facility in the state of Michigan, which allows for smaller residential psychiatric facilities for adolescents, children under 18. Those facilities are able to admit kids who have up to an inpatient level of care need, but the goal is to utilize those smaller facilities as step-up or step-down facilities for children who were in inpatient level of care. Additionally, this clarifies when personal restraint is allowable in emergency situations. It also clarifies that something that we call therapeutic de-escalation does not count as seclusion. Seclusion is considered when a child is put into a room or somewhere else and is not allowed to leave. That may be an instance when somebody is going through a therapeutic de-escalation process, when there is a fight or a child is acting out for whatever behavioral reason they may have. As long as an adult or a clinician is with the child working through that process with them, they can have them in a room and not allow egress. And then the final piece for this that's so important, we struck out some language that this only applied to facilities who receive funding from PIHPs or CMHs, struck that language out to clarify that juvenile detention centers are also subject to this law. So thank you again, and I'm here to take any questions.
Do members have any questions for the director? Representative Conlon.
Thank you, Madam Chair. Thank you for your testimony today. I do have a friend who had a child with schizophrenic disorder, and this had to happen in the state where she lives with her child. When that restraint has to happen, is a parent told ahead of time, or is it just in the matter that it happens? And how much will parents know about the experience their child did have in that facility?
That's a good question. The expectation is that every parent is aware of what's occurring with their child in a facility. If a parent or whoever has custody of a child is involved, they should be involved in the safety planning at the beginning, which really should outline when and if these types of interventions should be needed. So it should not come as a surprise if something like this occurs, and they should absolutely be made aware of that when it happens. Mm-hmm.
Are there any other questions? Thank you so much.
Thank you.
We will try to come back to Deborah Johnson on Zoom.
I'm sorry, I don't know. I couldn't hear anybody for a while, so I
We
missed
can
half
hear
of
you
Director
now. Thank you
Patel's,
so much.
Pardon me?
We can hear you now. Thank you so much. Begin when you're ready.
Perfect. Okay. So good morning, Chairperson Rogers and members of the Michigan House Policy Committee. My name is Deb Johnson, and I'm the CEO at St. Clair County Community Mental Health. My purpose today is to urge your full support for Senate Bill 227, which addresses a critical issue affecting our community. Due to the current legislation, our county has been unable to operate group homes, therapeutic group homes for children for many years. This bill presents an opportunity to modify the existing regulations, enabling us to safely operate therapeutic group homes within our community. Just to put this into perspective for you, a number of years ago, before that rule changed, we operated three 6-bed children's crisis homes that were full a lot of the time in our county. We had to close all of them due to the current legislation, which prohibits the use of any physical intervention for any reason, leaving a huge gap in residential treatment options for children who need this level of intervention. As I'm sure you're aware, our state has been facing a significant children's mental health crisis. Unfortunately, this lack of available options for children in need of therapeutic residential placements exacerbates the crisis. Senate Bill 227 offers the solution to this pressing issue by allowing us to establish and maintain much-needed group homes that provide essential therapy and support to vulnerable children. By passing the bill, you will not only help address the immediate needs of these children, but also contribute to the long-term well-being of our community. The availability of therapeutic group homes will ensure that children in crisis receive the specialized care that they require, reducing the strain on families and preventing further escalation of mental health issues. Moreover, the passage of Senate Bill 227 will foster a sense of hope and security among families who have been desperately seeking appropriate placements for their children. It will provide them with the reassurance that their children can safely access the necessary therapeutic interventions within our community rather than being forced to seek care elsewhere. So I implore you to consider the urgency of this matter and the positive impact that this Senate Bill 227 can have on the lives of countless children and families. By supporting the bill, you will demonstrate your commitment to addressing the children's mental health crisis in our state and ensuring that every child has access to the care that they need. And before closing, I just want to thank Senator Lowers again and his staff, especially Josh, for all of their hard work on this bill. It's come through two terms now. It was a different bill in the last term. And we appreciate, their perseverance with this. So thank you, all of you, again, for your time and consideration. I urge you to pass Senate Bill 227 and help us bring back much needed therapeutic group homes in our community.
Thank you for your testimony. Do we have any questions for Deborah from members? Representative Thompson.
Hi, thank you for your testimony. So my question is just to kind of understand and get a grasp of this whole thing. So when the state of Michigan closed down all of the state inpatient hospitals at that certain point, and then the CMHs were brought about, there were at that time, you're saying, group homes that were able to allow for patients or children that are severely emotionally disturbed to stay at these facilities. We did have
Yes.
access to those facilities.
We operated on 3 6-bed, we call them crisis homes for children, but yes, we had those, and then we had to close them because of the licensing issue.
Okay, so the licensing restricting the use of restraints meant that you had to close these facilities.
It restricted the use of absolutely any physical intervention. So one of our homes, for example, was 2 blocks from a very busy road. And if a child ran out of the house, ran down to the road, and our staff stopped them, and it had to be written up as an incident, it was a licensing violation. Or children were hurting other children, and you have to stop the child that was hurting the other child, then that was a licensing violation. And I'm not talking about any kind of chemical restraints or 5-point restraints, and I'm not talking about seclusion.
Right. I'm just trying to understand, because all this was just given to us last night, so I just want to get an understanding of it.
Yeah.
So now in the current state hospitals, they're, for example, Hawthorne, which they're now staying at Walter Ruth, or those children, the law does allow for them to have both chemical and physical restraints. Is that accurate?
That is accurate.
Yes. Okay. But the group home situation does not allow for it.
Correct.
Okay. And then within those facilities, are those children primarily guardians of the state, guardians of the facility, or are they still under their parents' care?
I can't speak to placements that come from other counties, but I know that many of the ones that came from our community are still with their parents. They're in their family's care, but because of the level of the acuity of their situation, that was the only place that we could send them. And we had parents actually that spoke before to Senator Lowers when he first took this on, but who sat in emergency rooms with their kids for days, weeks, and some even months, because if you leave, that's other kinds of issues. And so it's been really an extremely difficult situation.
I'm very glad that you mentioned that, because I too have had constituents reach out to me because if their parents do have to leave for work or health issues of their own, I've heard that these parents are having CPS called on them for abandonment of their children, and they're placed in a very difficult situation. So thank you for the information. Thanks a lot.
You're welcome, and I hope we have your support.
Thank you. Just for a clarification on the timeline, SB 227 was introduced on March 22nd of this year. A substitute was adopted on October 12. It passed the Senate unanimously on October 19. Are there any other member questions? Thank you so much. We appreciate your testimony, and we will read in the cards next. Supporting the bill is the Association of Accredited Child and Family Agencies. Supporting the bill, D.A. Blodgett and /St. John's Home, CMH Associates of Michigan supporting the bill, and Michigan Health and Hospital Association supporting the bill. Moving along, we will now hear testimony on House Bills 5169, 5170, and 5171, which pertain to the mental health screenings conducted at Well Child Visits. To speak to their bills, we have Representative Hood and Representative Grant, if you would like to both join us, as well as Carrie Kohlhaus from Moms Bloom. Welcome to Health Policy, and you can begin whenever you are ready.
start. Thank you, Madam Chair and members of the committee. As you've mentioned, we're here today to discuss improving the health and well-being of mothers and infants across Michigan. I'm a mother of 2 young women, and I know many of you are also parents. For those of you who aren't parents, you likely know that even a good pregnancy, a healthy and smooth pregnancy, still presents significant challenges, both mentally and physically, for women. Maternal mental health remains a problem across the state, and new mothers often lack proper resources to get the support that they need to navigate the first months with their new child. My bill, House Bill 5169, would require mental health screenings for new mothers to be offered as part of their baby's 4-week, 8-week, 6-month, and 18-month checkups as a way of finding and treating postpartum depression. Postpartum depression is not a character flaw or a weakness. Sometimes it's simply a complication during a pregnancy from giving birth. Postpartum depression is the most underdiagnosed obstetric complication in the U.S. About 15% of new mothers suffer from this form of depression following the birth of their child, but statistics on postpartum depression remain incomplete, as it's estimated that half of the cases go undiagnosed. Studies have shown that depressed parents can suffer family problems, marital problems. It can help to cause neglect, and it can absolutely impact a child's growth and development. These bouts of depression often last 3 months to half a year, and our current healthcare infrastructure has for too long overlooked the need for maternal mental health, both during and after pregnancy. Our package would improve and could even save the lives of many parents and children. My hope is that these bills pass so that more mothers are at their prime during the most critical times of their child's lives and early development. In Kent County in 2008, an organization was formed, Moms Bloom, and Carrie Kohlhaus is here, the executive director of that organization, to help support mothers. In 2015, a tragedy struck our community when a young mother, her name was Sasha, she had been isolated for quite some time, caring for her young children who were toddlers. She took her children to northern Kent County near one of our trails, the White Pine Trail, parked her car, left her children, and shot herself on the trail. Her 3-year-old found her and spent the night in this, rural space. It was late February, early spring. We all remember it vividly. And that young child almost lost her life, waiting all night next to her mother's body. And the young son in his car seat, in the car, without any support for hours. This tragedy touched home. It caused many of us to understand the importance of Moms Bloom and services like it. And I hope that today we can honor Sasha's memory by moving this bill. I'll pass it over to Rep. Grant, and then we'll hear from Carrie.
Thank you. Thank you, Madam Chair and members of the committee, for hearing testimony on these very important bills. As my colleague has stated, we're here today to discuss improving the health and well-being of mothers and their infants across Michigan. My bill in this package, HB 5171, would require that Michigan Medicaid programs cover the cost of mental health screenings during the postpartum period. Postpartum depression is a common complication after giving birth. By proactively looking for the risk factors of postpartum depression, we can both save lives and address health disparities across communities. The stress of poverty alongside socioeconomic factors contribute to the dangers of postpartum depression and therefore infant mortality issues. Studies have shown that depressed parents can suffer marital and family problems. it can have impact on a child's growth and development as well. We, as policymakers, should be taking proactive steps to protect the infants who are most in danger. The bond mothers have with their infants is priceless, and the time immediately after their birth is critical for establishing that. My hope is that these bills are supported so mothers are able to be at their prime during one of the most precious times of their lives, and that fewer children grow up with the trauma that can occur if your mother is experiencing postpartum depression without the needed tools or support. Thank you.
Thank you.
Thank you so much for having me here today. My name is Carrie Kohlhaus, and I am Executive Director for Moms Bloom, which is a nonprofit organization that services postpartum mothers. We're based in Kent County, and the way that we serve those families is by recruiting community members and training them on how to be a postpartum support volunteer, and then matching them with parents who have reached out and asked for support, whether it's practical support in the home caring for their newborns or emotional and social support. Something that we've noticed over the 15 years that our organization has existed is that so many of the women that we serve were not being diagnosed with postpartum depression. They were not being screened until their 6-week visit with their OB. Now, after 6 weeks, postpartum depression, having started maybe just a couple of days after birth, really can take hold, and mothers can begin to have intrusive thoughts of harming themselves, thoughts of harming their babies, thoughts that their baby might be better off without them. And when they don't recognize that this is postpartum depression and they aren't screened for it, they can get into a much deeper, darker place, and therefore require a lot more expensive health interventions like hospitalization, inpatient mental health programs. So what we discovered at Moms Bloom was that if we started offering screenings administered by our volunteers or our staff members a week, 2 weeks, 3 weeks after people gave birth, we were able to identify that that's what they were suffering from, and then we were able to connect them with resources like a therapist or having them call their doctor and be evaluated for medication. And we noticed that these mothers would then recover so much more quickly. They would then be able to bond with their babies. They would then be able to get back to work on time after their maternity leave was over. And we noticed with the mothers who weren't being screened until that OB visit way later, they were sometimes not able to bounce back as quickly, and they lost valuable, critical bonding time with their baby. And the impacts of that can go on for years. It's something that I experienced personally after the birth of my first child. I was blindsided by postpartum depression and did not recognize what was happening until months later. And I'm very fortunate that I did have the resources to recover and was able to make a full and complete recovery and have now formed a beautiful bond with my handsome, intelligent, funny teenage son. However, when I look back on his newborn stage, I lost that time, and I will spend the rest of my life grieving the loss of that time. I don't want to see one more mother in Michigan lose that time. I don't want to see one more child need expensive and difficult interventions because the bond, the critical attachment bond between mother and baby was not formed early on. I see these bills as such a simple measure that will frankly save our state money in the long run because more intensive medical interventions will not be needed when we can prevent, when we can treat early. I also see it as an investment in our workforce in the state of Michigan because I have seen firsthand hundreds of mothers who were not able to return to work on time and wanted to and needed to support their families because their mental health disorder went undiagnosed. So I urge you to approve these bills, which I think will be instrumental in improving the quality of life for both mothers and babies in our state. Thank you.
I see Representative Conlon's hand up first.
Thank you, Madam Chair. Thank you so much for this testimony. I imagine currently a pediatrician is one of the first to notice if a mother is experiencing difficulties anyway, and this says that they offer it. What happens, one, I hope pediatricians will be up for the task of learning how to do this properly, but what happens if the mother says, no, I'm fine, you know? because I know you can't make it a mandate, but what currently happens if there's a mother, obviously pediatricians must reach out to people, but I guess I'm wondering what that process would look like.
Right, so in Kent County, we've actually had the opportunity to test this out a little bit because we've worked directly with some pediatricians' offices to ask them to do these screenings, even though they're not being reimbursed for it and it's not mandated. And we've then created pathways for offering resources to the mothers and getting them referred to a mental health provider and encouraging them to follow up with their primary care physician. Ultimately, of course, it's on the mother to then receive that treatment, but if we can make sure that someone is following up with her and providing the resources and referrals and normalizing the experience, that can really increase the chances that she'll follow through and make a recovery.
Thank you. Other questions?
Can I also speak
Sure.
to that? So one of the main issues is someone knowing what they're dealing with. And so this package really addresses that, giving a mother and a family the information that they need to decide what's best for them. The intent isn't to mandate something and force families to take a certain route. And we've had conversations about who has access to this information, how is this information used. It's not meant to be used against a family to cause greater separation with a family and a child, but to give them the information they need to make the right decision.
Thank you. Any other questions? All right. Thank you so much for your testimony. Supporting all three bills, Elizabeth Cutter, Michigan Hospital Association, supporting all three bills, Michigan League for Public Policy, and that is it. Finally, lastly, we have House Bill 5173, which ensures that new parents are provided information on signing up for their child for health insurance. To speak to her bill, we have Representative Hope. First, we will adopt an H2 substitute before us, which is a product of discussions with the Michigan Health and Hospital Association and the Department of Insurance and Financial Services. And then we will hear testimony from Representative Hope. Representative Whitsett, Representative Hodsmo moves to adopt the H2 substitute to House Bill 5173. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett. Carter. Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Kapia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller.
Yes.
Rangans.
Yes.
Vanderwall.
Yes.
Filler.
Pass.
Mueller.
Yes.
Van Workum. Roth.
Pass.
Schmaltz.
Pass.
Thompson.
Pass.
Madam Chair, you have 12 yeas, 0 nays, 5 pass. The substitute H2 to House Bill 5173 is adopted.
Representative Hope, thank you for bringing this bill forward. Begin whenever you're ready.
Thank you, Madam Chair. Good morning, colleagues. I'm here to testify in support of HB 5173. This is a simple bill. It's fairly straightforward. It would simply require hospitals to provide information on the health insurance enrollment process for newborns. I've previously introduced this bill, and just to provide a little background, after a baby is born, the parents have about 30 days to notify their insurance company about the birth to ensure that the insurance covers the cost of delivery. I began looking into this legislation after I heard about a local woman who was charged $6,000 after she failed to notify her insurance company about the birth of her child within that 30-day window. Her employer revealed that she was not the first employee to have this happen, and it's no surprise that unexpected hospital bills can be devastating, especially a family that's just added a new baby. A 2023 study showed that medical debt disproportionately affects postpartum women. And compared to women who haven't had a recent birth, a woman who had given birth in the past year had about 50% higher chance of having unpaid medical debt. That disparity exists for people with private health insurance. Postpartum women who have lower income, who have gestational diabetes, who have asthma, face even higher rates of family medical debt. And there are several factors that contribute to medical debt, but this is one way that hospitals could help a new family, a new parent, insure their baby, and make sure that they're not blindsided by medical bills they weren't planning for. This document would be developed by DIFS in consultation with DHHS. It would simply include instructions on the insurance enrollment process for the newborn. And this would likely be part of a package of information that hospitals provide already. This is a simple measure that would save new parents from medical debt during what is supposed to be a joyful but chaotic time of their lives with a new baby. And I hope you'll support this bill. Just regarding the substitute that was just adopted, very briefly, the subs were from consultation with the Health and Hospital Association and DIFS, simply changing some language, technical language.
Thank you so much. Representative Reingans.
Thank you, Madam Chair. My question is about, in Michigan right now, how many hospitals do not currently provide this? Do you have a sense of that?
I don't know.
Okay, thank you.
We can maybe ask the Hospital Association to do a little survey and get that information back to you. Any other questions? All right, thank you, Representative Hope.
Thank you.
We do have a couple cards to read in supporting the bill, Michigan Nurses Association and Michigan League for Public Policy. Thank you everyone for your testimony today. It is my intention to move the remaining bills in the maternal and infant health package next week. I'm asking all interested parties to please get your feedback in as soon as possible so that we can consider any changes prior to committee next week. There being no further business before the committee will stand adjourned.